Hello, good evening. It's Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Thank you so much and welcome to this evening's live YouTube discussion. This evening, we're going to talk about a topic that is relatively common and it concerns the women. So we're going to talk about painful sex in women. Pain during sex in women. And medically, the phenomenon of experiencing pain during sex is called dyspareunia. So anywhere you see this in medical practice is actually an abnormality. So that's why you have things like dysmenorrhea when you're having pain during your bleeding, or when you have dysuria when you're having pain during urination. So in this situation, we're going to talk about pain in women during lovemaking. Now, 5 things you need to be conversant with about painful sex. 5 important things. Number 1, medically it's called dyspareunia. Now, this is frequent pain either before, during, or shortly after sexual intercourse. So dyspareunia can be before. So before means while you're trying to initiate sex through the process of foreplay and you feel pain, or in course of the sexual act itself, you feel pain, or shortly afterwards. Now, this pain can be superficial. That means it's just on the periphery of the vagina, or it can be deep pain when your partner is going a little bit deeper. Now, pain is a relative term. So what I mean by relative term, so what can cause pain in one woman can actually cause the opposite in the other. So, but there are different things which might likely elicit pain. So you need to know your own individual situation to know where the cause of that pain is coming from. Number 2 point, which you should be very conversant with, it's relatively common. In a lifetime of a woman, 3 out of every woman out there will experience pain at some point in their life. 3 out of every 4. So think about that. It's that common. So the possibility you might be experiencing pain as we talk now, it's high. Now, if we understand the pathway of that pain, we can begin to give you a couple of solutions. So know that it's common. You're not alone. Now, the next point you have to be conversant with, it's the different places you can feel the pain. The pain can actually be in either the whole part of the vagina, or deeper part of the vaginal tissue, or in the pelvic region. So the pelvic region is pretty much where you have all the structures for reproduction and the structures for urinary system. So that pain can be in the vagina, it can be in the pelvis, it can be lower back, it can be around the bladder. Any pain in that axis during or before or after lovemaking can actually be part of this dyspareunia. Now, there are a couple of things that can elicit pain during or after or before sex. Number 1, it might be physical thing. Number 2, it can be gynecological problems. Number 3, it can be emotional problems. The act of sex is a stepwise thing. So it starts with a process. It starts with a build-up. There are a couple of things that will happen in the body of a woman prior to initiating sex. Now, if there is any disruption in any of those pathways, it can lead to pain. If you have any... Sorry about that. So if there is anything that alters the normal pathway of lovemaking, then you might likely experience pain. So if you have any physical injury in the vagina, so probably from infection, probably from allergy, or probably from trauma, definitely it will cause pain. Now, if the emotional aspect of a woman, it's not in the right place. So if she's not happy with her body, if she's shy, if she's feeling ashamed, then her ability to initiate the hormones which will lead to relaxation, will lead to pain. So physical pain, gynecological related pain, and emotional pain, they are all intertwined together. If every other pathway in the body of a woman is taken care of, the vagina is structured in such a way that there will be zero pain during lovemaking. Now, another important thing you have to be conversant with is the fact that some women will experience pain shortly after childbirth or during breastfeeding. The reason why you might feel pain shortly after childbirth is because during childbirth, you are exposed to a couple of harm, which might be what we call iatrogenic harm. So in course of delivering your baby, you can have tear, little tear here and there. Some women can also receive what we call episiotomy. So if we want to aid your baby to come out without any injury, we can give you a little surgical cut to allow the baby to come out freely. So anytime in course of delivery, we cause any pain, that pain might also affect your ability to engage in the sexual act. So newly delivered mothers will likely experience pain if they resume sexual intercourse. And also is related to the fluctuation in your hormone. Remember that after childbirth, your body takes time to stabilize. So it's not unusual to see a new mother not participating in the process of sex because her body is still trying to adjust. The same thing is applicable to women that are breastfeeding. So when you're breastfeeding, there are a couple of hormonal changes in your body that might not allow you to participate in the process of sex. Now, finally, another important point to be conversant with. When you're aging, there are changes in specific hormones in the body of a woman which can aid in the process of sex. Key hormone is estrogen. So as you are aging, the level of your estrogen will be reducing. Your estrogen is the key hormones that gives you that difference as a woman, that puts you in the mood, that makes the vagina to be moist, that makes you to be ready for your partner. When the level of your estrogen is not within the range it used to be, when it's reduced, the likelihood you're going to have dryness, dry vagina, hot flushes, low libido is there. If your partner is not engaging in good foreplay and understood your own need, if your partner goes ahead to initiate sex when you're not ready, you're going to feel pain. So pain can also be part of aging. Now, be mindful that it's not only menopause. So menopause, it's more like your retirement as a woman. So it's not only menopause that can lead to dry vagina and pain during sex. There are a couple of hormonal changes that can lead to that. An example, some women abuse Clomid. Some women take a couple of other drugs, couple of other medications that can alter the natural ability which physiologically your body is supposed to function. So you need to be conversant with gulping any drug that your doctor didn't prescribe to you. Some of those drugs can affect your ability to, create an ambient environment to enjoy the process of sex. So these are the 5 things to be conversant with. So to wrap up, pain during sex is called dyspareunia. It can be prior to sex, it can be within sex or after sex. It's relatively common. 3 out of every 4 women out there will experience pain sometime in their life. Your pain can be physical pain or part of gynecological problem or part of your emotional pain. And also after childbirth and when breastfeeding, you can also have different changes in the hormonal aspect of your body, which can affect your ability to satisfy your partner and also have a buy-in effect. At this point, I'm going to open the clinic so I can take a couple of questions from the audience. So please, if you have any question, please feel free to ask me questions right now. I'm going to attend to your questions. So I think I have one participant. So please feel free to ask your questions and I will provide you feedbacks in real time. Okay, so go ahead and ask your questions, please. If you have any question, please feel free to ask. Hello, do we have any question? Okay, I'm trying to see if there are any questions. So in the absence of any question, thank you for coming this evening, and hopefully we find another important topic to discuss tomorrow. So once we can find the cause of your pain, that's the beginning of getting solutions. So your pain might be entirely, normal physiologic pain, gynecological pain, emotional pain, or it can be an infection. Any infection around the reproductive axis can lead to pain. So the key to getting solutions to vaginal pain during sex is finding what the cause is. So that's very, very important, okay? All right. So thank you for coming. And at this point, I'm going to take my leave. And I will see you guys tomorrow. Bye-bye for now.